afternoon, and I'm really glad to be here with you guys and excited to share some good information. And I just want to thank Ms. Moore for being such a great teacher and being excited about the information that we're about to share with you. I think it's pretty incredible that high schools are teaching such great classes that help you make some good decisions, learn some good information so that you can stay healthy and well for the rest of your lives. So we're going to talk about some things that are uncomfortable, maybe some things that may be a little touchy, and some things that may not be fun to talk about. First thing is, I'm a dentist here in town. My name is Dr. Amanda Canto. I practice in the Galleria area, and I've been practicing for 24 years. My practice has been really very focused on cosmetics, yet because of some unfortunate situations of having patients that have come in with oral cancers a bit too late, I've lost some patients, and since then it's really become something that I'm pretty passionate about. Preventing it, avoiding it, finding it, and now educating the public. And I'm excited to be able to come and share this information with y'all because oral cancers are something that are happening much and much more early. So first of all, I just want to get an idea. How many of you have known anyone with cancer? Quite a few of you, huh? Known of anyone with cancer that you didn't know personally? How many of you have known that there's such a thing as oral cancer? Cool. All right, so oral cancers. What are some of the things that you guys might think cause oral cancers? What's that? Awesome. She's on it. Oral sex. What else? What else? I hear somebody talking, and I know I was told that this class especially was going to be amazingly interactive, so I need some help. What? Dipping? Is that what I heard? Yeah. What are some other things that might cause some oral cancers? Drugs. Very good. Smoking, alcohol, that kind of stuff. All right. So we're going to talk about, first of all, what cancer is, okay? Because I think it's really important that you kind of get some basics. Cancer is pretty much an uncontrolled growth of abnormal cells in the body. Our body has a very, very fabulous and incredible way of working. And usually cells divide when they're needed and they die when they're not needed. But when we have an abnormal growth of cells, then we end up with cancers. People ask all the time, what are some of the symptoms of cancers? Well, it depends on what type of cancer and where the cancer is. However, some of the signs that we do see with pretty much all of them is that we can see fatigue and loss of appetite, loss of weight that's not explicable, different things. A lot of times they're associated with lumps or masses or pain, things like that, or even areas that may not heal or change, red areas, white areas, things that don't heal. So those things are a bit more advanced, and we don't really want to wait until we get to that point. So how do we develop cancers? Cancers grow out of normal cells in the body, as we said, so it's not like you have to be some special person with some special cell to get a cancer. Normal cells multiply, as I said before, when they're needed, and they die when they're not needed. So cancer occurs when the cell growth is out of control, when they divide too quickly, or when they don't die when they're needed. Now this is a very important fact, the next one, and that is that only 7% of cancers are genetically involved, which means that you can get them because of family predispositions. That means that 93% of cancers are really caused by some kind of an external factor, something that is an irritant, something that's infected you, something that you put into your body. So I want this presentation not to be a doomsday type thing, oh my gosh, we're all going to die. What I want it to be is some information for you to really get so that you can understand that there are things that you can do to make yourself healthy and stay healthy. What we ingest, what we eat, what we drink, the air that we breathe, what we put on ourselves, the sexual practices we keep, you know, all of those things are very, very important, and we can have some control of those things. So that's my whole goal, is just to kind of show you some things so that you make some good choices. Now, how is cancer diagnosed? To really be able to really get a clear diagnosis, a biopsy has to be made, and that normally means removing some tissue from the site and checking it out. What are some of the treatments? I'm sure if any of you have been around a person with cancer, they can be pretty devastating. When they're caught early enough, usually a surgery can be enough, and sometimes they can be small, sometimes they're not. Yet usually when we catch it, it's a bit later, and they have to combine radiation chemotherapy. And if any of you have been present to that, it's pretty devastating. Not only to the person with cancer, but also to the families and friends around, because it's pretty awful. This is a pretty important slide to me, because one of the things that I'm going to be talking about today is early detection, catching the cancers early. That's what's important here. If it's possible for us to get them, let's start knowing about it so we can catch them earlier. At stage 0, that's generally the earliest form. We can find them in a cellular level or in a very localized mass. As they keep getting higher in numbers, obviously it's spread more, and we have less and less chance of saving someone. By the time it's in stage 4, that's called a metastasis. Usually that means that it's gone to a different area in the body, and it's very unlikely that people will have a high survival rate. This is a good depiction on a picture of what it looks like at different stages. And I think that's really important so that you guys can kind of get a mental picture of what I'm talking about when I talk about when we detect them at different stages. Okay? Now, I don't see papers. You guys are supposed to be taking notes. That's okay. I want to make sure that you guys are listening, okay? So the C word, cancer. Nobody likes to talk about it, and most people think it's not going to happen to me. This is a really important slide, though, because I really want y'all to pay attention to this. Who will develop cancer in their lifetime? Statistics show that 1 out of every 2 men will have cancer in their lifetime, and 1 out of 3 women will develop cancer. So those are pretty devastating numbers. So again, I'm not trying to be this, oh my gosh, we're all going to die. What this really means is that we need to take charge of our lives and do something different. You know, we need to change what we're putting into our bodies, what we're doing with our bodies, what's happening around us, so that we can actually make a difference in these statistics and not have this happen. But this is what it is now. The data is showing that 1 out of 2 men and 1 out of 3 women. So, up to last year, the leading cause of death has been heart disease in the world. And as of last year, the leading cause of death, cancer, has actually superseded and is now the leading cause of death in the world. It actually shows that 1 in 3 people will develop cancer in their lifetime. 1 in 9 have a risk of developing cancer, again, if they survive the first time. And that 2 in 9 people have an increased chance of actually developing a different type of cancer. So what I'm trying to really get to you guys is this is a really important and very serious disease that needs to be really paid attention to and heeded to. This is a nice depiction just to show you where cancer stands in the top 15 global causes of death. Hugely overrates everything else. Now, there's good news and bad news with cancer. Although it is occurring more often, we are seeing that survival rates in most other cancers are actually improving. And one reason is because of better screening methods. So we have better tests, better science, which is really great. I'm sure that most of you have heard of mammograms for breast cancers and pap smears for cervicals and PSA tests for prostate. So all of these cancers are beginning to be caught more earlier, and people are more aware of them. So the increase of public awareness is super, super important. That's why I'm here. That's why your teachers have been so kind to ask me to come here, is because we want to be able to get this word out now and early enough that you would want to heed to it, share it, and tell everyone about it so that you know what's going on with you before it's too late. That's right. So the bad news is that oral cancers are not one of the cancers that are actually improving. Unfortunately, because of the fact that they have not been caught at early stages, the survival rate for oral cancer has pretty much stayed the same. What we now are very clear about is that oral cancer is officially an epidemic, and early detection is critical. So all of the numbers of cancers have increased, oral cancers being the most, yet some of the other ones have decreased as far as their mortality rates. And when we talk about cancers, and we talked about it first, tobacco use, alcohol use, dipping, drugs, those kind of things, those are usually what we all think about. However, we're finding 40% of the diagnosis are coming with younger, non-smokers, non-drug users, so not these people with those risk factors. The sad reality is that 63% of these cancers are being caught in that late stage 3 and stage 4, okay? And I'm going to share with you why. So, with that being said, they only have 50% survival rates. The mortality rate for oral cancer then has not changed in 30 years, while all the rest have. You have to ask yourself why. I know I have. And that's because although dentists have been taught in dental school to actually check for oral cancers, the unfortunate reality is that there's only about 7% of the population in dentistry that's actually doing it consistently. And we've really found that about 3% are using some of the newer technologies to be able to catch it much earlier. So how many of you visit the dentist regularly? Okay, that's good. It's quite a few. And for those of you who do, are you aware of ever having a cancer screening? Have your parents talked about a cancer screening? Okay, really super important that you ask your dentist, okay? Certainly we'd love new patients, but that's not what this is about. This is about spreading the word. I really want people to challenge their dentists to make sure that that's what they're doing for them and that they're using the newest technologies. And for those of you who are not seeing the dentist, please get yourself in because it's important, okay? The incident rate of cancer, of oral cancers, has definitely increased in the past 5 years, with alone in 2007, an 11% increase. And as we said, the high mortality rate is because it's being discovered late. So this is really important, something that you guys, I want you to remember. Oral cancer kills 1 American every single hour of every single day. Again, it kills 1 American every hour of every day. So that's pretty serious. In the Hispanic community, we're seeing that it is the #1 killer. And in the African American community, we're seeing that it's occurring twice as much, with 80% of them being found in late stages. So we want to make sure that we share the information and really get people to know what this is about. Again, some of the traditional risk factors are a previous history of cancer. If you've had cancer before, certainly puts you at a higher risk of having cancer again. Normally, we think about people that are older. And although that's still a high risk, we actually are seeing 17-year-olds with oral cancers. We're seeing 19-year-olds, 23-year-olds that have died of oral cancer. So if you're even curious about it, get on the Oral Cancer Foundation site and it'll show you. So it's happening more and more often to young people. And obviously the tobacco and alcohol use are still part of it. However, again, 40% of those are starting to happen without having these significant lifestyle risks. So, what is that? Who can tell me? What is it? What is it? Nope, not cancer. What is it? Nope, cool. What did you say? A virus. That's right. That is actually a picture of the human papillomavirus, or HPV. And this is something that you really need to look at because this is now the leading cause of oral cancer. So, the emerging risk factors. The top emerging risk factors are sexually transmitted HPV. It is the fastest growing sector or segment of it. It has increased 5-fold. And the Center for Disease Control is actually stating that anyone 17 years old and older should be screened at least once a year. In my office, it happens at least twice a year, some patients 4 times a year. And if there's any reason that we suspect or we diagnose that there's been an oral HPV, we increase that. So there are ways of testing for that. Another thing that I want to ask, Gardasil is the HPV vaccine. How many of you have had that? The vaccine for HPV? All right. Something that I really have to tell you, that to me is huge. I'm a huge advocate because if you get that vaccine before you're sexually active, you're really in good shape. That's going to help you quite a bit. A vaccine doesn't mean that you can't get the virus, but it's going to help you dramatically, and more than likely you wouldn't get infected that way. The earlier in that sexual cycle, the better. And there is only a window of time that you can do it. It's now approved for 9-year-old boys and girls all the way up to 26. But after that, you're on your own. The later you wait, the worse that the chances are that you might be infected. And unfortunately, they're saying that, kids 15 years old, 25% sexually active. I may think that's higher. 17-year-olds, whatever. But oral sex does come with risks, and cancer is one of them. So you have to be very, very present to that. Now, this is a very important slide, guys, and I want you to pay attention to this because when an oral cancer is diagnosed, they can actually check to see what it is that caused it. And the HPV negatives, or the ones that are caused by something other than HPV, tobaccos, alcohol, those kind of things, those have actually decreased, and that's because people are getting smarter about their practices of smoking. So we've seen a 50% decrease on that. But look at the HPV positive ones. They've increased by 225%. Now, to me, that's absolutely astronomical and not something that we should go without thinking about. All right? So HPV exposure, how can it be transmitted? HPV can be transmitted through saliva, through sexual contact, skin-to-skin contact, and it is responsible for a 15-time increase in oral cancer diagnosis. So we ask, how likely can you be? It's shown that men are 2 times more susceptible to having a general oral cancer than women. HPV-related cancers, 6 to 7 times more common in men than women. And here's a number that I really want you to pay attention to, because this is a big one. If you have 6 sexual partners or more in your lifetime, I'm not talking about later, in your lifetime, you have 8.6 times more chance of getting cancer. So, something that you really need to think about, okay? And here's one of those things. I like this little cartoon because everybody thinks, oh my gosh, I'm not going to get it, blah, blah, blah. And so who can have it? Bottom line is that the CDC actually reports that 90% of the population has been infected with HPV at some point. Right. Exactly. Hello. So, because at some point it's going to happen, I would highly recommend that you think about those vaccines. Along with that, I would highly recommend how often you're going to put yourself in, the Russian roulette situation, okay? Because it can happen. So be really, really mindful of what it is that you're doing to yourselves. HPV comes in many different forms and different types. There's about 100 different types of this virus. Not all of them cause cancers. A lot of them can cause just a wart, all of those things, the skin eruptions, those kind of problems that don't make you happy looking at. But they're real. However, there are some of the strains that can cause cancers and do cause cancers, like HPV 16 or HPV 18. And they can lead to oral cancers, cervical cancers, or anal cancers. So, I want you to remember this one. Oral sex is not safe sex. I don't know why people think it is just because you can't get pregnant, but I think dying is worse. And you can get cancer and die, and that's really horrible. So, it is something to really, really think about. HPV and oral cancer. Prior infection with HPV 16 gives us 9-fold increase in the risk of oral cancers. If you've actually had an oral HPV, it increases your chances by 50%. That's a pretty huge number. And 60% of the oropharyngeal cancers are HPV related. And when we say oropharyngeal, that means the throat, the soft palate, your tongue, sometimes the jaw, it spreads around. So it's not a very pretty sight and something that really you need to be present to. So it is, at this point, the leading risk factor for oral cancers over tobacco and alcohol. Now, I like this slide because it's got a lot of information. You're going to get, at the end of this, some information that's pretty much this put together for you to take home. But I like this because it is a study done by Mount Sinai, which is one of the leading cancer research facilities in the world. And they have definitely made clear relationships of HPV with oral cancers. And again, it's got the numbers of if you've had 6 or more sexual partners, you've got 8.6 times more likelihood to get the oral cancer. If you've got 1 to 5, you're 2 times more likely, and smoking 3 times more likely. Add alcohol, drugs, and all those other things, and we've got even more problems. So, a lot of really good information. This is a very important slide, guys, and I hope that you really look at it. This is a prom picture on the left. That means someone young, someone vibrant, someone that had a whole life ahead of them. And a few years later, this is what he looked like because he lost his jaw, he lost his tongue, part of his throat, can't taste, can't speak, feeding tube, not cool. And more than likely probably won't be around or wasn't around to live much longer. And this is what happens to you. So it's not pretty. And does that mean, oh my gosh, we're all going to end up this way? No. It just means you really have to be smart about what you're doing. So please think about it. Again, here's the important point for me to put out there, and that is that early detection is important. If you remember that slide that we showed with the different stages, stage 1, stage 0 all the way to 4, we want to be able to catch things if we have to at an early stage. And that just means that you need to get in and be checked, okay? So if we can catch it between stage 1 and 2, we have an 83% survival rate. Any earlier than that, we've got even better. But if we wait until we can feel something or see something, you know, people think that they can look or feel, or I don't feel bad. Just because you don't feel anything doesn't mean that something's not happening. So you want to be checked. Make sure that you're really pressing for that. Because, again, the reason that we're having such poor mortality rates is that they're being caught way too late. 63% of them are being caught in stage 3 and 4. So why is it so hard? Why is it discovered so late? It's not because it's difficult. It's really because a lack of public awareness. And that's why I'm here, and that's why your teachers have been so great to ask me to come. Because we want to make sure that you guys are really getting this information. Not because we want to scare you to death, but we kind of do. But at the same time, it's really just to spread the word because it's important. There also hasn't been a real comprehensive program to really be able to screen. So we're putting an initiative together to where we are combining different technologies. We combine a technology of salivary tests to be able to check for HPV. And we're also using the type of technology that I'm going to show you up here so that we can actually screen. And then also any kind of biopsies are done by brushes, so we can check that. So how do we catch it early? We need to screen early and screen often. So anyone 17 years and older, how many of you are 17 in here? Soon? You guys are all, what's up with you guys? You guys are quiet today. Yeah. Thank you. All right. Then we need you guys screened at least annually, and if not more. Another really super important point, and this is one of the things that I want to show you today, and at the end we're going to take some volunteers. And I'm expecting this class, because Miss Moore told me that this is a really special class, I'm going to expect you guys to jump up and help me. So we're going to be using fluorescence technology. As I told you, one of the biggest problems that has occurred with dentistry is that we've been waiting to see it with our hands, with our eyes, and feel it with our hands. And sometimes we can't always see what's going on. There's now technology that we use that can see it long before we can actually catch it with our naked eye. So let me kind of pull this up and show you. This is what's called the oral ID, and it's fluorescence technology. It actually puts out a particular wavelength of light, and when the tissue is healthy, and you look through the filter of the glasses, the tissue shines bright green or white, right? Anything that is healthy absorbs that light and reflects back. Wherever you see an area that is dark like that, that doesn't necessarily tell us that it's cancer, but what it does tell us is that there's something not okay there. We need to check it. So I'm a dentist, and I'm pretty trained to look for things. If I were looking, this is the back of someone's mouth, this is where the molar is, this is the soft palate, or right in the back of their throat, here's the tongue. If you were to look in the back of your throat in a mirror, would you really think there's something wrong there? Because I wouldn't. I wouldn't have thought that was a big issue. However, look at that. So without this technology, we can miss a lot of things. And I want to show you a few slides of some normal things and some not so normal things, okay? Because it's really important that you ask about this type of technology. So, normal versus abnormal. We had a young man in here earlier in the class before who actually dips tobacco, and he was asking me about leukoplakia. He says, what's leukoplakia? I said, well, that's good. We're going to show you. Because we're trained to look for that. You see this white spot? So I would have thought something's going on there. This is one of the things that we're trained to look for, right? So if I were to look at this picture as opposed to this one, where this tongue, it's not pretty, but it doesn't look like anything's going on there, right? So look what happens when we show you it with the fluorescence technology. That top one, although you see some little blood vessels, those are really pretty normal. But everything pretty much shines green or white to you, right? Take a look at that bottom one. Yep. So that big dark area was abnormal tissue, and once it was actually biopsied, I believe it was a cancer. So we can't always see with our naked eye what's really there, and it's really important that we press and ask for technology when you're visiting your dentist, because guess what? Who else is looking in there if it's not your dentist? No one else. Not like that. So you need to ask for it. Okay? I remember showing you, well, remember we showed you this picture before and I asked you if you thought anything was wrong there. That actually was a true cancer also. So, what can we do so that you're really on top of this? Go in on a yearly basis minimum, get a lot of education, really think about what the information is telling you, make some good decisions because that's what's really important. I am going to give you a copy of this particular brochure because I think those numbers are really important. Remember that. 6 sexual partners or more, 8.6 times more likely. That's pretty frightening. So, just remember that what you see sometimes is only the tip of the iceberg. There's a lot of stuff that goes on underneath. Okay? So, I'm hoping for some questions. What questions might I answer for you? It's an iceberg. Yes, that's what that looks like. What you got? Yes, sir. It's an open form. Yes.
Okay. What if you're a virgin, right?
Mm-hmm.
What if you have like oral sex with like 6 other virgins and you still get cancer?
Guess what? You're no longer a virgin if you're doing that. Unfortunately. Sex is sex. Oral sex is still sex. And you can still be transmitting viruses. It's not safe sex. That's a good question, though. And I appreciate you asking out loud. It's good. It's good. Anybody else? Questions? All right. I need some volunteers. And everyone loves this because you get to see and you get to see what it looks like and you get a nice screening. So who wants to come up and be volunteer? Have screening. Awesome. We're going to turn off the light a little bit. Okay?
Just sit down.
Yes, sir. Have a seat. He's cool. A lot of people get a little freaked out, especially younger, groups, that if you go and you're going to ask for this or whatever, that you're going to be admitting that you're having sex. You know what? It's not about that. This is about just really learning some good practices, starting to take care of yourself, knowing that you need to be screened. It's not an admission of anything, and it doesn't make you into some bad person. I have to tell you that we've got people that have said that, but I don't live that kind of a lifestyle. It has nothing to do with that because you can't guarantee who's been with who at the time that you start, okay? So talk about those, vaccines, talk about being really careful with what you're doing and making some good choices. And the best choice that you can do is to make sure that you're vaccinated and that you're getting screened, okay? Who wants to see? And is it okay if somebody looks? Does anybody want to look? Come on up, come on. Here, move forward a little bit so that they can actually see better. Here you go.
Okay.
All right, so put your head back and open for me. It's all good, man. It's all good. You're good. All right, open, really big. Can you see in the roof of his mouth? Yeah, you can get a little closer. That's what I'm wanting to see. So you see how it's all nice and white or green around the. That's normal. Take a deep breath for me and say ah. Got some tonsils. It's all good. All right, and open for me. You bite your cheek right there, don't you? Right back there.
Kinda, yeah.
Yep. All right, I think you're clear. You're going to live. It's all good. All right. Anybody else you want to be screened? Have a seat.
I'm good.
Oh, come on. All right, man, that's good.
I just want to see.
Oh, you want to see? All right, come on up. You guys are mean, man. Y'all stop that.
You're Asian. You have all kinds.
Y'all stop. All right, you ready? Okay, you ready?
Yeah.
I swear,
All right.
I don't want to die.
Good. We don't want you to. All right, so you're going to look at the tissue. See how it's really kind of, and the light's starting to get a little dim on me. I need new battery. You see everything's really pretty even. You don't see any of those dark areas, right? Cool, there.
And you're pretty clean.
Everything's good. Take a deep breath for me. Say ah. One more time. Say ah. You see how I can see all the way back to the back of the throat?
Yeah.
That's really pretty interesting, right?
Yes.
All right. Who else? You want to see? You want to sit down? Have a seat. I'm just going to look. Sit all the way back, Camilla. It's all good. You're good.
Okay, I can barely get these glasses on.
Okay. Get a little closer. This way. There you go. All right. Open for me, Camilla. Open real big. Oh, look at her glitter on her face. How cute is that?
What?
You've got glitter on your face.
Oh, that's weird.
Open for me.
Yeah, it's all green.
It's all green, you see?
Yeah.
Okay, take a deep breath for me, sweetie. Have you had a little bit of sinus stuff going on? Allergies?
Mm-hmm.
Yep. I can see that. Okay, lift your tongue for me. Everything looks good. Awesome. You've got some little tiny spots in the back of your throat. Those look like they're allergy related. Okay?
Yeah.
So is that good? Did you
Yes.
see?
Yeah, so I saw
All right. The sparkles. Isn't that cute? Little sparkles. Awesome.
Probably my makeup.
It is. It's from your makeup. All right. Anybody else? Come on. Yeah, come on.
No.
No scary. It's all good, I promise. All right, so you're going to get nice and close so you can see because the light's getting a little dim on me.
You brush your teeth.
All right, open for me and put your head back all the way as much as you can so you can see. Okay, I want you to look up in her palette. So there's one little dark spot, but that looks like it's just from like maybe a little pizza or something, chip, because it's not very big. Take a deep breath, say ah. Stick your tongue out for me and say ah. You see how you can see all the way in the back of her throat?
Yeah.
You see none of those big dark circles like you did at the other thing. You see? Pretty cool, huh? All right.
There you go.
All right.
Was that good?
Anybody else?